Welcome to Vikas Learning, where we're making learning new and different.
In today's topic, we are going to learn about terms used in the process Medical Billing AR, follow-up of Revenue Cycle Management. Terms are what is Social Security Number SSN, National Provider Identifier, NPI, Taxonomy, Taxpayer Identification, Number TIEN, and Provider Transaction, Access Number PTAN.
Social Security Numbers, SSNs, are special 9-digit codes given to U.S. citizens, permanent dwellers, and temporary inhabitants. They are mainly used for tax and identification reasons. It's crucial to keep your SSN private to avoid identity theft and fraud. NPI, or National Provider Identifier, is a unique ID number for healthcare providers in the US. Providers like doctors, dentists, hospitals, and clinics use NPIs for administrative and billing tasks. The NPI is a 10-digit number given by the Centers for Medicare and Medicaid Services (CMAs) via the National Plan and Provider Enumeration System (NPPES). It acts as a standard ID for healthcare providers for all transactions covered by HIPAA. An NPI makes it easier to identify healthcare providers, smoothens electronic transactions, and aids in preventing fraud and abuse in the healthcare system. In US healthcare, taxonomy codes classify healthcare providers and practitioners by their specialty or expertise. These codes are mainly used for billing and administrative tasks, especially in electronic transactions. Here is how taxonomy codes are used in US healthcare. Provider identification. Every healthcare provider or practitioner who bills for services needs a National Provider Identifier (NPI). Along with the NPI, providers get one or more taxonomy codes to identify their specialty or practice area. Billing and reimbursement. When asking for reimbursement, healthcare providers include their NPI and related taxonomy codes. This helps insurance companies and other payers understand the services provided and ensure correct reimbursement. Provider directories. Taxonomy codes are often used in provider directories, both for internal use within healthcare organizations and for directories available to the public. Patients can find healthcare providers based on their specialty using these codes. Regulatory and reporting purposes. Taxonomy codes are used for regulatory purposes and reporting requirements, like for Medicare and Medicaid programs. They assist in tracking healthcare provider trends and ensuring regulations are followed. Taxonomy codes are kept up to date by the National Uniform Claim Committee (NUCC) and the National Uniform Billing Committee (NUBC) in coordination with the Centers for Medicare and Medicaid Services (CMAs). They are a key part of the healthcare billing and coding system, ensuring accuracy and consistency in healthcare transactions. In US healthcare, TIN, or Taxpayer Identification Number, is a unique ID number given to entities for tax reasons by the Internal Revenue Service (IRS). In healthcare, the TIN is often used in billing and administrative tasks, especially for provider enrollment. When healthcare providers join Medicare, Medicaid, or other insurance programs, they give their TIN for identification and billing reasons. Claims submission. TINs are included on healthcare claims sent to insurance companies or government payers for reimbursement. Tax reporting. Healthcare organizations use their TINs for tax reporting, including income tax filings and reporting of healthcare-related taxes. TINs are crucial in ensuring correct billing, reimbursement, and tax compliance in the healthcare industry. PTANs, or Provider Transaction Access Numbers, are unique ID numbers given to healthcare providers who bill Medicare for services given to beneficiaries. PTANs are used in Medicare transactions for billing and administrative tasks. Here is how PTANs are used in the Medicare system. Provider enrollment. Healthcare providers who want to bill Medicare for services need to join the Medicare program. During this process, they get PTANs, which act as their ID numbers for Medicare billing. Claim submission. When a provider sends a claim to Medicare for reimbursement, they include their PTANs along with other needed information. The PTANs help Medicare identify the provider and process the claim correctly. Provider verification. PTANs are used by Medicare beneficiaries and other stakeholders to check the credentials of healthcare providers participating in the Medicare program. Tracking and monitoring. Medicare uses PTANs to track and monitor provider activities, including billing patterns and compliance with Medicare rules. PTANs are typically 7 characters long and can include numbers or letters. They are given by Medicare Administrative Contractors, MACs, or the Centers for Medicare and Medicaid Services, CMAs, to eligible healthcare providers when they join the Medicare program.
Thank you for watching.